Hello everyone, my name is Kate and let's start this year with IHSM podcast. Today we are pleased to host an IHSM graduate who has successfully integrated in the clinical practice and working as a urologist, Dr. Ahmar Munir.
Hi everyone, my name is Ahmar. As most of you might remember, we started few months back, and thanks for having me today. And my apologies for the delay because my routine has been very hectic due to the hospital work and the busy schedule.
Yeah, that is the most awaited meeting
Yes,
here.
yes. So thanks for having me.
Yeah, and after so many years, you're again here. What do you feel?
So today I came here after I think 2 years, and I was feeling, when I entered the building, I was feeling very good and nice. I had a very good and nice feeling about it, coming back to the university where you spent your 5 years, and it's great. I'm feeling good.
So nice to hear that. And could you please introduce about yourself more details?
So I'm a third year urology resident at the Dock University Hospital, which is one of the top and most respectable private medical institution in this country, I would say. And I'm a final year urology resident. This year I'm completing my specialization.
Wow, that is a really good clinic. I have heard a lot. And what motivated you to choose this profession?
So choosing medicine was mostly my own decision, and my late father also wanted me to become a doctor. And then in my life I had experience. One of my nephew got diagnosed with the cancer, so I spent a lot of time with him during his treatment, and that incident inspired me a lot to pursue the medicine. And after completing the school and after completing the 2 years of college education, it was very tough to get into a medical college in Pakistan due to the huge competition. So I was, and my family, they offered me different options. They advised me, so you can go maybe to armed forces or engineering and different options. So I stood firm on my decision, and I was searching for some options in abroad to pursue my medical education, because it was not possible to continue or get into a medical school in Pakistan. It was tough. So I came to know about the IHSM through one of our senior graduates of IHSM, and that's how my journey with IHSM began.
Wow, that's really touching and memorable and inspirational story of yours to become such a doctor. And reflecting on your years back in IHSM, is there any troubles that you have been through?
So if I look back to the university years at the IHSM, at the start it was tough, because coming to the new country and adapting to the weather is totally different from our country, and then there is a language barrier. So slowly I started adopting and learning language, and then everything became easier, you can say, and it was fine. After maybe I think a year or 6 months, I was used to.
You got adopted fast, right?
Yeah.
As all our students, I think so. Is there some kind of trouble while you were studying here?
So if we talk about my study years or student years, they were very memorable for me, and I miss my university days, because there were a lot of different students from different backgrounds and different cultures, and it was very enjoyable and was very fun. I always miss my university years. So if we talk about some problems, though, at the start, the first one was the language barrier. So I started learning language very fast. Even after 6 months, I was able to go to my daily communications and my daily course, daily life. I was on my own. I didn't needed anyone's help. So, and the other thing we faced was the education system is in our country is a bit different than here. In here we have to travel during university days. We had to travel to a lot of different campuses and different hospitals to attend classes and for clinical practices. So that was a bit exhausting, and so that's how it is in here. We cannot change the system, but as soon as you get adopted to this situation, it becomes easier. So with the time, yeah, it was good.
Except this problem, rest of it was all good.
Yeah, I would like to say the teachers at the IHSM were very professional, skillful, and very trained doctors. And I remember at the 4th year, the IHSM opened the simulation center, which was a very big step in improving the medical education and improving the skills provided with the. And that simulation center provided the realistic learning and environment that really prepared us for the clinical practices.
Oh, that's amazing. Coming back to the teachers, was there any particular discipline or faculty member who played a significant role in your study time?
So, as I mentioned during, I spent my time with my nephew during his treatment. So, after that time or during that time, I would say that my interest was if I was thinking all the time that if I will go to the medicine or I will pursue medical education, then I will go into oncology. So then in here, I would like to mention Dr. Margarita and our ex-dean, I would say Ainura ma'am. They inspired me a lot. Their passion and mentorship had a lasting impact on my approach to the medicine.
Wow, that's amazing that you're still in touch with them and you're doing a lot for IHSM. And could you please tell us more about your current work, because I think everyone is so interested in the particular of your profession.
So as I mentioned earlier, I'm a 3rd year resident and working at Dock University Hospital. So if we talk about the typical day or life of a young doctor or young specialist or becoming a young specialist, it's very hectic and very tough, and I would say sleepless. So if we talk about the day, my day starts at 8 a.m. I go to the hospital and check my and the day starts with the rounds, and I do rounds on the previously admitted post-op patients, and after that we have planned surgeries and emergency surgeries in urology department. So when the new patients are getting admitted, we go with them, have a chat with them, explaining the procedures which they will go through, and discussing with the seniors. We discuss every case and every surgery in detail before going into the operation. And then after that, we discuss everything with the anesthesiologist. So that's kind of every young doctor that does. So after that, I'm headed into the operation theater, where I spend most of my time in our hospital. So after completing surgeries and after day's work, I'm headed back to the evening rounds to the patients again to check on them, and there are some documentation, and after that I just go home straight, and that cycle continues every day like that.
Okay, to fulfill my curiosity, I would like to ask you a question, like what kind of surgery you're most frequently performed there?
So I'm a urologist, so generally I'm working with we have 12 or 13 very trained, very skillful, and one of the best urologists in our hospital. So I work with all of them. So in every specialty, or we have some subspecialties. So I'm working generally in all subspecialties, because I have to know everything. So then I will choose some subspecialty to pursue my career in it. So mostly I work with the kidney stone disease, and I kind of like it, the kidney stone disease. So we do a lot of operations in endourological department. In urology, there is a department, we call it endourology. So we deal with the BPH, we can say mostly kidney stone disease, bladder cancer, and all these diseases.
Well, that's amazing, you know. And since you're working and performing with patients, they must be Russian-speaking patients, right?
Yeah.
So in your curricula, you used to have the Russian languages, and after graduating, you already were in the Russian environment. So what about your language skills in there?
So I always love to talk about my Russian language, how much I know, how fluent I am in Russian. So mostly in hospital, most of the time the patient doesn't even realize that I'm a foreigner or something. They think that I am local. So that's not a problem. They are very kind and respectable, and they are good to you. Then they approach, or they are good to you if you are a professionalist and you have a kind conversations with them and you deal with them properly. So that's not a problem. And my Russian is fluent. I'm just, you can say I'm a local. Yes. I'm more comfortable in speaking Russian than English.
Even so.
So yeah, I'm so used to Russian that speaking in English, it's a bit tough for me sometimes. So.
I would really point out that you have amazingly good level of Russian language skills.
Thank you.
And based on your experience working with and treat Kyrgyz patients, how do they perceive that you're a foreigner doctor and you're treating them? How do they react?
Yeah, sometimes I would say maybe 1% in 100% someone will say that no, they will not say. They will ask, "Where are you from?" If they have some doubt, and I will say, "I'm from Pakistan," and they don't believe me that I'm from a foreigner or I'm from Pakistan, because I speak in Russian that good that they don't even believe that. If I would say that I am from Pakistan, they will not believe that. They will say that your grandparent or your mother or your father, there is someone in your family which is Russian, that's why you speak Russian very well. So that's not an issue. People are very kind to us, to foreign doctors. There is no, I haven't feel any difference from my other colleagues. The behavior of the patients, behavior of the local patients towards the local doctors and towards me, I haven't felt any difference in it. As much as your approach is professional and good to the patients, that's not an issue. The people are good. So
that is really wonderful, you know, to hear that our graduates staying here after graduation, and you got adopted here so much. And I would like to ask you to some recommendation to our current students to, you know, to motivate them to study and stuff.
So my advice to the current graduates, or not graduates, to the current IHSM students would be, so I will start from my experience. I would like to share some things that they should learn. So when you come here, you started studying in the first year, try to learn language as quickly as possible, because it helps not after your degree or something. I kind of count it as an extra with your medical study, because going to any other country, for example, if someone comes here in Kyrgyzstan, and there is an extra benefit for coming here, you can learn a new language that can always help you in your life. Anywhere you go, because the Russian speakers are a lot in the world. So I count it so, or maybe at least they should learn a basic language, Russian language in their daily life, so they can adopt quickly and go on with their daily lives without any help or without any issues and problems.
That was actually a good advice to our current students to succeed academically and professionally in their future career and now. And talking about the future, where do you see yourself in 10 or maybe 15 years?
So in next 5 to 10 years, I count myself as working as in the field of urology and learning new advanced techniques and new surgeries and doing some research and maybe training some future residents myself. So I believe this is just the beginning of a journey. I think it's for a doctor, I would say the learning journey, it continues throughout life, because every year, every month, there are some new techniques and some advancements in medical and in procedures. So there is a lot. The learning goes on. So I see myself working here maybe for a few more years to get some more experience, or maybe I will stay here permanently, or maybe I will move to some another country. Let's see, time will tell.
Yeah, you have so many options to stay here in Kyrgyzstan, to return back to Pakistan, or pursue your opportunities elsewhere.
Yeah.
And finally, Dr. Ahmar, what does being an IHSM graduate represent to you?
So being an IHSM graduate means a lot to me. It's just not a degree, it represents the resilience and diversity and ability to adopt and grow in a foreign environment. IHSM just not gave me the medical education, but responsibility, mentorship, and the experience that shaped me what I am today. So wherever I go, I will always carry my IHSM pride with me.
Well, that was such a great reflection, you know, and with that we would like to wish you a very great success in your future and in your medical career with this small gift from IHSM. Please kindly.
Thank you very much.
Okay, bye-bye.